Doctors at government hospitals are legally allowed to do extra work in the private sector as long as they do it outside their normal working hours. However, a study by Human Resources for Health suggests many senior and specialist doctors abuse the system by working both jobs at the same time. To discuss this and its impact on quality healthcare further, we're now joined by Dr. Aslam Dasu from Progressive Health Forum. Dr. Dasu, always a pleasure talking to you. Thank you so much for making time for us this morning. How does this actually work? I mean, when I read the report, it didn't make sense to me how one doctor can be in two places at the same time. But clearly, there is an issue of moonlighting here.
Good morning. Thank you for inviting me. Yes, look, this is another lamentable problem that plagues the public health service. About 15 odd years ago, professional staff, particularly doctors, were beginning to leave the public service because of the really inadequate salary structures and poor working conditions. And in order to mitigate that, the government allowed what is known as remunerative work outside of the public service. And as you introduced the segment, you mentioned that doctors in particular would be allowed to practice in private outside of their normal working hours. Now, in any working situation, there's a set of conditions which employees must abide by, including the doctors. And if it is not enforced, those conditions get abused. And so it's not surprising. We've heard of doctors excessively utilizing this ability to go and supplement their income by neglecting their duties in the public service. And this just adds to the burden in the public service. So yes, it's a real problem, and it's been around for a long time, and there has been an inability by the management, by the administration, to effectively manage this arrangement.
Yeah. Doc, please just paint us a picture of the effects this has on, patients as well as would-be, training specialists. I mean, if a specialist doctor has to be on shift in a public hospital, for example, and there's an intern coming through who requires or needs the training of an experienced specialist, but they are not there, obviously there is a knock-on effect there in terms of both the patient and the training specialist at the same time, and what they lack from this experienced specialist.
Yes, so you've just mentioned both the major ills of this problem. One is that there is deficient patient care, and second, there is insufficient supervision by senior doctors over junior staff. And I must mention that when this system was put in place, there was also a move by the government to improve the salary structure of health workers, and there has been a substantial improvement. One would have expected that this system would have been phased out, given that it was so poorly controlled and having these negative effects. However, it has remained, and we are now in quite a bind, because an attempt to clamp down on this or to eliminate this problem will see an exodus of many doctors from the system. So, it's a self-made problem of the government, and it needs to be properly managed. Look, it's a simple matter, actually, at one level. You're allowed to go and do this work. It must be after hours, and it must be properly monitored and managed. It's that last bit, the proper monitoring and management, that is not present. We are depending entirely on every individual's inner discipline not to take advantage of this. Yeah. And, it doesn't. So a minority of the physicians, and is a minority, do abuse the system, and something needs to be done about it. The academic platforms are very unhappy with it.
Yeah, absolutely. So the question is, what does government then do, as you mentioned, to manage this problem? Because also taxpayers rely on these doctors, Dr. Dasu, to also play their role in public hospitals. But if they continue to pay and they're not receiving that value from doctors, it's a loss on the taxpayer side. How can government then better manage the situation, do you think?
Well, there are a couple of things. One is that I don't think the problem is in the salary remunerative structure. I think that has been sorted. I think the inability of the government to even monitor this is where they should focus urgently and put in proper systems. But I think that will take time. The one other element, which I think unfortunately hasn't been utilized, are the professional associations of doctors, of nurses who do this, pharmacists, etc., to institute among their members a greater sense of propriety around this matter. And I think a combination of those factors are necessary right now. The point really, though, is that a lot of the doctors who may feel encumbered by an idea that we must remove this system will actually leave because the other conditions in public hospitals are so poor that, on a balance, it would be easier for them to work privately or emigrate or things like that. So the problem is systemic, but on the specific matter, it's hardly possible that a major employer like the government can't manage a straightforward matter like this. If doctors transgress the rules to which they are signed up, there must be consequences for that. But there aren't any. Some people are calling this fraud, white-collar crime. It may well be that, but then you have to prosecute that problem, and there's none of that. So the situation persists, and unfortunately it falls on the administration to account for it.
Yeah. Well, I appreciate you speaking to us about this, Dr. Dasu, and hopefully something can be done about this in a matter of urgency. Because, I mean, I've been reading articles about, a specific unnamed individual. In the article was a trainee doctor and relied on a specialist pediatric to assist. But they went to their private practice and, the doctor in training didn't know what to do with this young baby's life, which was in danger. That definitely says that lives can be jeopardized due to the mismanagement of this system. But I appreciate you, Dr. Aslam Dasu, Progressive Health Forum convener and health activist, for speaking to us this morning. Now,